Well, hello everybody. Thanks for coming. I'm Dr. DeWitt, as most of you know. We're going to talk about the cancer time bomb in your fridge that pretty much everybody might have in there, and we're going to talk about different things you can do to make it less cancer-causing, and some of the just crazy stuff that's going on in the community and in the big corporations that unfortunately my uncle had a part in too, which you'll find out, which is disappointing, but we'll talk about that. So currently, if you get diagnosed with cancer and unfortunate enough to have that diagnosis, you have three choices: surgery, chemotherapy, or radiation, according to the medical profession. And the thing about that is you would think those are the three best options as far as they're concerned. But they don't produce any studies that really show the effectiveness of these, which you would think if these were the top three, they would say, see, this is how good it is, this is how well it works. Not necessarily the case. And actually, 75% of MDs would not take chemo if they actually got diagnosed with cancer because they just don't think it works. I thought that was a little frightening. So if they're not going to take it themselves, I don't know why they're so eager to prescribe it to everybody else. And Dr. Levin, that wrote The Healing of Cancer, actually pointed out that most people die because of the chemotherapy, not because of the cancer itself. So, and it's been shown that it does not cure breast, colon, or lung cancer. And it's been documented for over a decade, but still they utilize it in their prescription for fighting tumors. It's just because they do what they've always done, even though it doesn't work. And in America, unfortunately, in the Journal of Clinical Oncology in 2004, they came out and said that the 5-year success rate for chemotherapy is only 2.1%. 2.1%, that's the best we can do? That's pretty sad. Breast cancer is the most common cancer among women. 1 in 8 women today are going to get breast cancer if they just eat whatever they want, which is what we're going to talk about. You don't want to eat whatever you want. You got to be conscientious of what you eat. And they say 1/3 of those cancer patients actually are genetic, but we actually believe that it's less than that. But if you decide to eat healthier foods, healthier food choices, that'll prevent your risk or greatly reduce your risk of developing breast cancer or any kind of cancer. So instead of the fast food, you have the fruit. So this is one of the main things we're going to talk about. It's milk, and it's not the casein in the milk that we've talked about before. The casein, they have all kinds of studies in rats, etc., where the casein in cow milk actually causes tumor growth, and they've adjusted it with the Forks Over Knives film that we talked about a few weeks ago, that if you have an increase in casein, then you have increased tumor clusters in rats, but if you decrease it down to 5% of the diet, then it reduces the amount of cancer. So you can actually control it based on the casein. But this is something we're talking about today. It's recombinant bovine growth hormone, which is a synthetic version of growth hormone. rBGH is what they call it. And unfortunately, about 1/3 of the cows in America are taking this particular growth hormone. And of course, the reason they do that, they give it to the cows because it makes them produce more milk. But there's some really disturbing pictures I'm going to show you that it affects the cows negatively, and then that ends up getting into the milk, and that ends up getting into especially our babies and young children because they're more susceptible. So this, I don't know if you can see from the reflection, but this is a poor cow that's been injected with the growth hormone. And this is called mastitis. It's when the udders get way overgrown. And this poor cow's back is all arched, and I mean, it can barely even walk. And it's just because it's going to produce more milk. It's not going to be good milk, and it's going to be infected with this hormone that actually gets turned into the IGF-1, insulin growth factor 1, which is directly connected to breast cancer risk. But as I said, makes more milk, means more money to the dairy industry. So the biotech company Monsanto, they actually bought this, or came up with this idea and wanted to sell it to the world. They genetically engineered it from E. coli, which I thought was interesting. And they also manufacture Agent Orange, which we all know about in Vietnam. And unfortunately, that is what my uncle, Herbert, yes, my uncle actually went to MIT and helped design and develop the chemical formula for Agent Orange, unfortunately. Yes, it's definitely not his claim to fame. But, hi, Gail.
They got that one.
Yeah, and they also developed the PCBs, the polychlorinated biphenyls, and dioxin. These are all chemicals that are used in the making of rubbers and things like that, so they don't ever break down. There's no biochemical breakdown. They last forever. And so a lot of these are illegal now, but unfortunately the rBGH they still make, and it's the largest selling dairy animal drug in America, which actually leads to it being banned in Canada, Japan, Australia, New Zealand, and 27 other countries. So they don't sell U.S.-made milk there because they're worried that it's going to have the rBGH in it and it's going to cause increased cancer in all these different countries. But it's okay here. You just can't get it there. Scary. And in 1997, years ago, these two reporters for Fox News were going to uncover this. And they got a letter from the Monsanto lawyers that said they would suffer dire consequences if they actually came out and uncovered this going on and the risks with the rBGH. And so they went to Fox and said, all right, we should do this, right? I mean, we're going to uncover, tell the truth, etc. They were actually bribed by Fox, the network itself, to not talk about it on the news. And finally they said, okay, well, we're going to need to revise it, so let's edit it down. They did 83 edits later of the story, and then they ended up shelving it anyway and went to court. They ended up winning a court settlement for $425,000, but then later on the higher court said, you know, it's okay, they aren't covered by the whistleblower status. So basically the finding of that court said that reporters don't have to report the truth, they can report whatever they feel is newsworthy. So it doesn't have to be true or not. So I thought that was kind of interesting. This was Dr. Epstein. He's a specialist in breast cancer, and he was talking about the different side effects that happen in the milk with the rBGH treated cows. You can have the increased insulin growth factor 1 that I was talking about before, and then that leads to them having to be treated with more antibiotics because they get the mastitis, the inflamed udders. See, the dog doesn't like that. And other rBGH-induced diseases, as well as pus from increased rates of mastitis among the cows injected with the rBGH. So just unpleasant things. Some more side effects of the rBGH: increased levels of the thyroid hormone enzyme thyroxin 5 monoiodinase, just bad stuff. And long-chain fatty acids, which are not easily digested, which are bad and unhealthy as well for people. And all those are bad for the people, but they're also bad for the poor cows getting injected with these hormones. And there's actually a horrible stat in a little bit that we're going to talk about, where a lot of the cattle that have been injected with this have to be put down because they can't continue to survive under such conditions. And even the Monsanto, their own company that does it, said that 80% of mastitis is in the hormone-treated cattle. So they say, yeah, it messes up the cows, but they didn't care. It was resulting in more money for their company. And they don't even acknowledge that there's any problem with the milk and the causing side effects in people. And this was the Canadian Journal of Veterinary Research in 2003, found 16 different harmful medical conditions resulting from the hormone administration. 40% increase in infertility in the cows, 55% increased risk for lameness, shortened lifespan, hoof disorders, visibly abnormal milk, which is a little disturbing. And it's found to be a potent hormone that acts on your pituitary gland that induces powerful metabolic and endocrine effects. So this is all the different stuff that's going into the cow here, and then it's hooked up to the milk, and then the milk goes right onto the assembly line and out to the people. It increases your IGF-1 levels by 20-fold. It's excreted in the milk. It's frightening stuff. So this basically talks about how pasteurization, that doesn't destroy the protein that's in the milk. So pasteurization doesn't help anything. We don't want to drink pasteurized milk anyway because it kills all the good bacteria. So it's not something that we need to really think that pasteurization is going to cure the problem. We need to go focus on organic milk. Organic raw milk is really crucial. And like I said before, it's more susceptible. The little ones in our lives that we care about the most are the ones that really absorb these negative toxins in the milk. And we just don't want to let them be exposed to that. So almond milk is really good. Soy milk's not good because it's got the estrogen levels in there. So almond milk is good, or the organic raw milk if it's from a farm that you're aware of, a local farm. So only 1 out of every 10 breast cancer cases is attributed to genetics. The other 9 are triggered by environmental factors. So that's something that we can control. And diet is a big part of that. It's been documented in 50 scientific publications over the past 30 years that increased IGF levels in hormone-treated milk increases your risk of breast, colon, and prostate cancer. For 30 years they've known about this, but still, it's still out there. People that aren't aware, they keep drinking it. But that's what it's all about. They inject them, and that makes them bigger, and that makes them more money. And it's the highest in breast cancer patients have the highest IGF-1 plasma concentrations. And ironically, see, didn't like that either. And that's how the breast cancer actually, the drug tamoxifen, that's how it works. It reduces the blood levels of IGF-1. So you're getting it from the milk. I mean, it's just scary. So it's just increasing your risk tenfold like we talked about earlier. And back to Dr. Epstein again, it talks about how early stages of cancer development, they're supposed to go through apoptosis, which is when the cell actually dies on its own because it's distorted. But this IGF-1 actually blocks your ability to naturally defend yourself against altered cells, so it allows them to proliferate. And it's not just breast cancer, it's also colon cancer and prostate cancer, as we said before. So there's a nice picture of a colon. So Monsanto land, they come up with the PCBs, the dioxin, and the Agent Orange. So basically, you can't read it right here, but it says you actually have to be genetically modified in order to survive in a world where they are doing all these genetically modified organisms. Another interesting thing, when you genetically modify something, then technically you own it. So then you can patent it and make more money. So if you genetically modify a cow, then or milk, you actually own that milk and can get more money. Or genetically modified crops. The person that comes up with this, Monsanto, they actually can own it that way. And I had a patient earlier today, it was really sad. They used to work on a farm, their families did, and Monsanto actually contacted them, it was actually the last patient of the day, and said that they had to take a percentage of their profits and give it to Monsanto because they were going to start genetically modifying stuff, and it was like a requirement. They couldn't choose not to. It was just a requirement. I mean, it's just scary what these big companies that have all this money can do. So you might be drinking the hormone milk right now, or yogurt. You never know. Because no labeling is required, despite people have been complaining about it forever. The only way to know that you have a hormone-free milk product is drink organic milk or almond milk, or what else? Soy milk wouldn't have any hormones, but it has the estrogen, but it wouldn't have the growth hormone in there. So organic milk is enjoying an annual growth rate of 20%, even though people in general are drinking milk. This is regular milk, drinking less. It's dropped by 10%. And it is preferable to regular milk, but it still contains the dangerous hormone. And it's not recognized or recommended drinking any milk that is pasteurized, even if it is organic. You don't want it pasteurized. So you need to drink only raw milk that comes from a small farmer that you know and trust, which might be a little harder to find around here, but if you go inland a little ways, you can find some, and online you can find one that's good. And you need to avoid genetically modified foods or higher processed foods, because that's going to keep your family healthier. And we can also email you. We're going to leave out a sheet of paper, or I'm going to leave out a sheet of paper, and you can write your email to me. And I'll send you a 9-page genetically or non-genetically modified organisms, products, and how to shop for them, and where you can find them. It's really helpful, actually. This was really sad. 135 of 200 cows that were in this man's herd in 1994, he had to put them down because they were on the hormone. And they stopped, once he got them off the hormone, because he wanted them to be healthier, wanted to have higher quality products, they wouldn't produce milk anymore. So it totally messed up their system. Majority had mastitis, so he had to replace, well over 50% of his herd. And I'm sure he couldn't afford that. It's just sad how the big companies are ruining the little guy. Back in 2008, this gentleman here in the House of Representatives, well, I don't know if I'd call him a gentleman, he made it illegal to name or to label milk as synthetic hormone free because it was called misbranded if you couldn't actually come up with a laboratory analysis to see that it was genetically modified, because when it comes out, and you try to test it, it just comes out as regular growth hormone in the cow because it's recombinated bovine growth hormone is what the rBGH stands for. So it just is at a higher level. But according to him, you know, that's fine, that's normal. It's something that's in there anyway. So this is a copy, or just the front page of the non-GMO shopping guide that we can give to you, and I actually have a copy up here if somebody wants to look at it. Here's some more cancer dangers. If the milk's not bad enough, the nitrosamines, which are present in bacon, can cause bladder cancer. And when you grill, you form heterocyclic amines on your meats, so they are carcinogenic as well. So if you cook your meat to medium or medium well, it has more cancer-causing factors than if you have it medium rare or rare, which is juicier and better. It's just better for you if you're going to eat it. But it also needs to be grass-fed beef as well. You don't want to have any of the beef. Most of the beef that's not labeled as genetically organic, etc., and grass-fed, it's going to have these hormones that you don't want to have in there. Even this was something I thought was really interesting. Even cooked chicken breasts, if you get skinless, boneless chicken breasts, it's actually got the nitrosamines as well, which can cause bladder cancer. So you need to cook the chicken with the skin on and then take the skin off, because the skin has got a lot of the bad cholesterol, etc., in there that you don't want to ingest. So these are things you need to try to buy organic or grow yourself. Peaches, apples, because basically these have so many pesticides, etc., on them in the regular grocery store that it's almost impossible to clean them off all the way unless you have like a colloidal silver spray that you can spray on there that'll help to neutralize the pesticides. And these things you can actually buy in the grocery store that are pretty safe: broccoli, eggplant, bananas, etc. Asparagus, frozen sweet peas are good. And something else you can do that I thought was interesting, you can cook with these different spices, and that'll actually reduce the toxicity of the HCAs in the stuff that you barbecue or cook at high temperatures by anywhere up to 40%. Rosemary is a really good protector against the HCAs. Turmeric that's found in yellow mustard is really good, and in curry spices. And ginger as well is really good. It's used in Thai cooking. So if you add some of that in there, that helps to counterbalance it. If you have to have your red meat and you have to have your barbecue, throw some yellow mustard on there, or just sprinkle a little rosemary, and it's tasty too. Especially the chicken's really good. Here's an example of a patient we had. He's 56 years old, had high blood pressure, and as we know, from up in the upper thoracic spine, the nerves go to the heart here, control blood pressure. He had that for over 10 years or 15 years, and because of that, it had led to depression. So he was spending $750 a month on medications. So after 90 days, we'd straighten up his spine right in this area here. His blood pressure normalized, and he didn't have to take any more medications for his blood pressure or depression because he was happy because he didn't have to take his meds. This was Ray. He'd been taking hypertension meds for 12 years. You can see the same misalignment here. This is him facing us straight. After 90 days, he as well was straightened up, no longer needed his high blood pressure medications. So this is our autumn special with our nice little Thanksgiving theme. You get a consultation, exam, digital x-rays, report of finding, and an adjustment. Usually that's $275. Now you can get it for only $25. Do you have any questions?